1. Which cranial nerve is assessed by asking a patient to follow a penlight with their eyes? Answer: oculomotor nerve. Explanation: the oculomotor nerve controls most eye movements, assessed by tracking a penlight, ensuring accurate evaluation of neurological function in clinical settings. 2. What is the priority nursing action for a patient experiencing a tonic-clonic seizure? Answer: protect the patient from injury. Explanation: protecting the patient from injury by patting surfaces and clearing hazards prevents harm during a seizure, a critical safety measure in neurological care. 3. Which brain area is most likely affected in a patient with a stroke presenting with slurred speech? Answer: Broca's area. Explanation: Broca's area in the frontal lobe controls speech production, and damage causes slurred speech, guiding neurological assessment and intervention planning. 4. Which reflex is tested by stroking the sole of a patient's foot? Answer: Babinski reflex. Explanation: the Babinski reflex, elicited by stroking the foot sole, assesses upper motor neuron function, critical for detecting neurological abnormalities in adults. 5. What is the most appropriate position for a patient with increased intracranial pressure? Answer: head elevated 30 degrees. Explanation: elevating the head 30 degrees promotes venous drainage, reducing intracranial pressure, a key intervention for patient safety in neurological emergencies. 6. Which cranial nerve is responsible for the sense of smell? Answer: olfactory nerve. Explanation: the olfactory nerve transmits smell signals, assessed by identifying odors, ensuring accurate neurological sensory evaluation in clinical practice. 7. What does a Glasgow Coma Scale score of 15 indicate? Answer: normal neurological function. Explanation: a Glasgow Coma Scale score of 15 indicates normal consciousness, guiding nurses in monitoring neurological status and patient safety. 8. Which medication is a first-line treatment for status epilepticus? Answer: lorazepam. Explanation: lorazepam is administered intravenously to stop prolonged seizures in status epilepticus, ensuring rapid control and patient safety in neurological emergencies. 9. Which spinal segments are tested by the patellar reflex? Answer: L2, L4. Explanation: the patellar reflex assesses the L2, L4 spinal segments, a key deep tendon reflex for evaluating neurological motor function in clinical assessments. 10. What is the primary function of the cerebellum? Answer: coordination of movement. Explanation: the cerebellum fine-tunes balance and coordination, critical for assessing ataxia and ensuring safe mobility in neurological patients. 11. Which cranial nerve is tested by asking a patient to stick out their tongue? Answer: hypoglossal nerve. Explanation: the hypoglossal nerve controls tongue movement, assessed for deviation or weakness, a key component of neurological cranial nerve evaluation. 12. What is the most common motor symptom of Parkinson's disease? Answer: tremor. Explanation: tremor, often resting, is a hallmark of Parkinson's disease due to dopamine deficiency, guiding neurological assessment and patient care planning. 13. Which pathway transmits pain and temperature sensations? Answer: spinothalamic tract. Explanation: the spinothalamic tract carries pain and temperature signals to the cortex, critical for assessing sensory deficits in neurological examinations. 14. What is the priority assessment for a patient with a suspected spinal cord injury? Answer: sensory and motor function. Explanation: assessing sensory and motor function determines the level and extent of spinal cord injury, guiding immediate neurological care and patient safety. 15. Which cranial nerve controls facial expressions? Answer: facial nerve. Explanation: the facial nerve governs facial muscle movement, assessed for symmetry, a critical step in neurological exams to detect deficits like Bell's palsy. 16. What is the primary purpose of elevating the head of the bed for a patient post-craniotomy? Answer: reduce intracranial pressure. Explanation: elevating the head promotes venous drainage, reducing intracranial pressure, a vital nursing intervention for neurological patient safety post-surgery. 17. Which brain structure regulates body temperature? Answer: hypothalamus. Explanation: The hypothalamus controls temperature via autonomic responses, critical for maintaining homeostasis in neurological patients during clinical care. 18. What is the hallmark sign of increased intracranial pressure? Answer: Cushing's triad. Explanation: Cushing's triad, hypertension, bradycardia, irregular breathing, indicates increased intracranial pressure, a critical finding requiring urgent neurological intervention. 19. Which cranial nerve is assessed by testing the corneal reflex? Answer: trigeminal nerve. Explanation: The trigeminal nerve provides sensory input for the corneal reflex, a key test for neurological integrity in unconscious or high-risk patients. 20. What is the primary nursing intervention for a patient with myasthenia gravis experiencing muscle weakness? Answer: administer pyridostigmine as prescribed. Explanation: Pyridostigmine enhances neuromuscular transmission, improving muscle strength, a critical intervention for managing neurological symptoms safely. 21. Which spinal segments are tested by the Achilles reflex? Answer: S1, S2. Explanation: The Achilles reflex assesses the S1, S2 spinal segments, a key deep tendon reflex for evaluating neurological function in the lower limbs. 22. What is the primary function of the thalamus? Answer: relay sensory and motor signals. Explanation: The thalamus relays sensory and motor information to the cortex, critical for assessing neurological sensory deficits in clinical practice. 23. Which cranial nerve is responsible for swallowing? Answer: glossopharyngeal nerve. Explanation: The glossopharyngeal nerve innervates pharyngeal muscles for swallowing, assessed to ensure safe oral intake in neurological patients. 24. What is the priority nursing action for a patient with a Glasgow Coma Scale score of 7? Answer: ensure airway patency. Explanation: A score of 7 indicates severe impairment, and ensuring airway patency prevents hypoxia, a critical safety measure in neurological emergencies. 25. Which brain area is responsible for language comprehension? Answer: Wernicke's area. Explanation: Wernicke's area in the temporal lobe governs language comprehension, assessed for deficits like aphasia, guiding neurological care planning. 26. What is the primary purpose of administering mannitol to a neurological patient? Answer: reduce intracranial pressure. Explanation: Mannitol, an osmotic diuretic, draws fluid from brain tissue, reducing intracranial pressure, a critical intervention for neurological patient safety. 27. Which cranial nerve is tested by assessing shoulder shrugging? Answer: accessory nerve. Explanation: The accessory nerve controls the trapezius muscle, assessed by shoulder shrugging, a key component of neurological cranial nerve evaluation. 28. What is the most common sensory deficit in a patient with a C6 spinal cord injury? Answer: loss of sensation below the clavicle. Explanation: A C6 injury disrupts sensory pathways below the clavicle, guiding neurological assessments and patient care to prevent complications. 29. Which brain structure modulates emotions? Answer: amygdala. Explanation: The amygdala, part of the limbic system, regulates emotions, critical for assessing behavioral changes in neurological disorders like anxiety. 30. What is the primary nursing action for a patient experiencing a migraine headache? Answer: provide a quiet, dark environment. Explanation: A quiet, dark environment reduces sensory stimuli, alleviating migraine symptoms, a key intervention for neurological patient comfort and safety. 31. Which cranial nerve controls lateral eye movement? Answer: abducens nerve. Explanation: The abducens nerve innervates the lateral rectus muscle, assessed for eye movement, critical for detecting neurological deficits in clinical exams. 32. What is the primary goal of seizure precautions in a neurological patient? Answer: prevent injury. Explanation: Seizure precautions like padding bed rails prevent injury during seizures, a critical safety measure in neurological nursing care. 33. Which pathway transmits vibration and proprioception? Answer: dorsal column medial lemniscus pathway. Explanation: The dorsal column-medial lemniscus pathway carries vibration and proprioception signals, assessed to detect neurological sensory impairments. 34. What is the primary assessment tool for evaluating consciousness in a neurological patient? Answer: Glasgow Coma Scale. Explanation: the Glasgow Coma Scale assesses eye, verbal, and motor responses, providing a standardized measure of consciousness for neurological patient safety. 35. Which cranial nerve is responsible for pupil constriction? Answer: oculomotor nerve. Explanation: the oculomotor nerve controls pupil constriction via parasympathetic fibers, assessed to evaluate neurological function in clinical settings. 36. What is the primary cause of muscle rigidity in Parkinson's disease? Answer: dopamine deficiency. Explanation: dopamine deficiency in the basal ganglia causes muscle rigidity, a key symptom guiding neurological assessment and treatment planning. 37. Which brain structure regulates breathing? Answer: medulla oblongata. Explanation: the medulla oblongata contains respiratory centers, critical for monitoring vital signs in neurological patients to ensure stability. 38. What is the primary nursing intervention for a patient with a suspected stroke? Answer: perform a neurological assessment. Explanation: a neurological assessment identifies deficits and guides urgent stroke interventions, ensuring timely care and patient safety in emergencies. 39. Which cranial nerve is tested by assessing taste on the anterior tongue? Answer: facial nerve. Explanation: the facial nerve controls taste on the anterior two-thirds of the tongue, assessed to detect neurological sensory deficits in clinical practice. 40. What is the primary purpose of a lumbar puncture in a neurological patient? Answer: obtain cerebrospinal fluid. Explanation: a lumbar puncture collects cerebrospinal fluid for analysis, aiding diagnosis of neurological conditions like meningitis, critical for patient care. 41. Which brain area controls voluntary motor movements? Answer: motor cortex. Explanation: the motor cortex in the frontal lobe initiates voluntary movements, assessed to detect neurological motor deficits and guide rehabilitation. 42. What is the primary symptom of a patient with myasthenia gravis? Answer: muscle weakness. Explanation: muscle weakness, worsening with activity, is caused by acetylcholine receptor dysfunction, guiding neurological nursing care and safety measures. 43. Which cranial nerve is responsible for hearing? Answer: vestibulocochlear nerve. Explanation: the vestibulocochlear nerve transmits auditory signals, assessed to evaluate neurological sensory function and guide patient communication. 44. What is the primary nursing action for a patient with a Glasgow Coma Scale score of 3? Answer: initiate emergency airway management. Explanation: a score of 3 indicates coma, requiring immediate airway management to prevent hypoxia, a critical safety intervention in neurological emergencies. 45. Which brain structure relays sensory information to the cortex? Answer: thalamus. Explanation: the thalamus relays sensory signals, except smell, to the cortex, critical for assessing neurological sensory deficits in clinical evaluations. 46. What is the primary purpose of administering phenytoin to a neurological patient? Answer: prevent seizures. Explanation: phenytoin, an anticonvulsant, prevents seizures, a critical intervention for stabilizing neurological patients and ensuring safety. 47. Which cranial nerve controls downward eye movement? Answer: trochlear nerve. Explanation: the trochlear nerve innervates the superior oblique muscle, assessed for downward eye movement, critical for neurological cranial nerve testing. 48. What is the primary assessment finding in a patient with a cerebellar injury? Answer: ataxia. Explanation: ataxia, impaired coordination, results from cerebellar injury, guiding neurological assessments and safety interventions like fall prevention. 49. Which spinal segments are tested by the biceps reflex? Answer: C5, C6. Explanation: the biceps reflex assesses the C5, C6 spinal segments, a key deep tendon reflex for evaluating neurological motor function in upper limbs. 50. What is the primary nursing intervention for a patient with a transient ischemic attack? Answer: monitor neurological status. Explanation: monitoring neurological status detects changes after a transient ischemic attack, guiding timely interventions to prevent stroke and ensure patient safety.